Dr. Alalade at AsktheGynaecologist. While you're watching, I want to quickly test my audio to ensure that my audio is good. And it's a wonderful day. Today is Sunday, and it's a wonderful day to be alive. So today is a special topic day, ectopic pregnancy. And the reason why I've chosen this topic today is because someone asked a question about ectopic pregnancy the last time when we were on live. And I decided that the next time we come up live, we'll be talking about ectopic pregnancy. So if you're free this afternoon joining me, I know you're just coming from church and from society meeting and all that, but if you're free, join me and let's have a quick time together and discuss this important topic, ectopic pregnancy. It's important that you spend time every day to exercise and to make sure your body is up to top notch. Today, this morning, I took a quick cycle around town, and it's amazing how you feel and how invigorated and alive you feel just breathing fresh air and being, having the opportunity, to be here. You see, the moment we are here on this earth is a time to increase and improve value for people. So if you're free this afternoon, join me and let's talk about this topic today, ectopic pregnancy, what causes it and how it can kill a woman. I still remember the first day I saw a woman had ectopic pregnancy when I was in medical school at the Diaraba, Luf. That was about 1990. I can't remember the year, but I just know that it was before 1999. I was in school that day in the A&E at Luf. And I remember a lady coming in with pain and she was diagnosed with ectopic pregnancy and we have to go to theater. Thank you, Mushibolaton, 14. Thank you so much. So if you can hear me clearly, please give me some thumbs up and let us start this discussion. If you're watching me on ATG Facebook, please give me thumbs up. Let me know if you can hear me on ATG Facebook. I'm not sure if I'm on ATG Facebook, but if you can see me, watch me on ATG Facebook, please give me thumbs up. If you can see me and watch me on ATG Facebook, please kindly give me some thumbs up. I can see Coco Agnes and Anuwa Daeze. Are we live on Facebook ATG? If I am, please give me thumbs up. If I'm not, let me know. Probably I'm using the wrong channel. Coco Agnes, are we live on ATG Facebook? Please give me thumbs up there. So we have a sizable crowd on Instagram. I'm talking simultaneously live on Instagram, and I'm also talking recorded version of YouTube, and we are here on Facebook here. I can see a lot of love from somebody on Facebook. I don't know who that is, but if you're the one sending that love up here, thank you so much. I love you too. You're precious, and I'm so happy to be here and to share these few things I know. So, I'm a doctor, ATGs at home, and we are here. Thank you, Coco Agnes. I can see that green Shrek hand is wonderful, beautiful. So, Coco Agnes, are we on ATG Facebook Live? Please confirm that. Coco Agnes, are we on ATG Facebook Live? If so, let me know that. Say and text that we are live on ATG Facebook. Let me know. Coco Agnes, I'm waiting for you to give me that information. Coco Agnes, if we are live on ATG, yeah, good. And is this Coco Agnes? Is this ATG Facebook? I know I'm on Facebook. Sandra Kaolisa, I know I'm on Facebook, Coco Agnes. But are we on ATG Facebook? Please give me that confirmation now. Are we on ATG Facebook? Thank you, Sweet Damsel on Instagram. Thank you, Sweet Damsel, for being here. Yeah, so if you can see me on ATG Facebook Live, please text that on this page quickly. Let us see that before we start talking quickly. Okay? But if I'm not on ATG Facebook, I mentioned that was a mistake, then I need to quickly sort that out. But if you're watching me on ATG Facebook, please text it that we are Sandra Kaolisa. Thank you so much, Sandra, for giving me that confirmation. So we are on the right channel. So definitely we can start our discussion now, and it's about ectopic pregnancy. What causes it and how it can cause death and how we can prevent ectopic pregnancy from happening. So first of all, I can see that we are up live now and people are watching on Instagram. Instagram guys are already. Liz Queen, Susie, Esther Michael, thank you Elizabeth for being here. So I'll wait for people to join, then we start talking. Thank you, Charles Linda. Thank you, Coco Agnes. Thank you, Cynthia Buchi, Patrick Ofuja, and Azatulan Tessie, Bamidele, Atinuke Niola, Inkem Jenny, Coco Agnes, Basira Tafalanyon, Liz Queen, Esther Michael, Jenny Abe, Sweet Damsel, Stephanie Echini, Z Light, Moshibolato on Instagram, Fresh Home of Fashion, Ibeni Art Fashion Academy, Adiola Ogumola, Enyi something precious, Enyi Nanya precious, Strictly Yummy, Moshibolato, thank you guys, Inyanga Couture, and Desai One. Thank you on Instagram. So we have got Vivian High, Coco Agnes, Lawani Nancy on Facebook Live. So our topic today is ectopic pregnancy. Ectopic pregnancy, okay? Okay, ectopic pregnancy. Okay, if you can see my writing, let me know. If not, let me know. So that's ectopic pregnancy, and I'm going to draw a tiny diagram of the uterus, okay, and the tube, and the womb there, and the tube, and the womb there, and the cervix, and the hole. That is the whole of the cervix, the cervical horse, okay? And I'm going to draw the body of the womb, okay? That's all muscle, red all the way through, and the body of the womb, and that's all red, and the same thing here too. The womb is all red all the way through. Okay, now we have the tube there, okay, and we have the ovary. Let's put ovary in black here. So we have the ovary here, ovary attached to the womb, and we have the ovary here attached to the womb. Over here we have the tubes on this side, and we have the tube on that side. Okay, good. So everybody can see me live and clearly direct on Facebook, on YouTube, clearly. Good. Thank you, Blessing Ezekiah. Thank you, Ogundele Mary, Oga, Fumi Eletu, Cynthia Ezine, Akin Shelley, Damilare, Lawani Nancy. Thank you guys. Elizabeth Fediba. Thank you guys. So let us continue our talk now. So we are still talking. Lily Bature, thank you. They are all our moderators. They are all here. And guys, God bless you. So I hope you can see me clearly. Maris Ehikioya, Zubi Mulkan, and Faith Chika 296 on Instagram. And we have Ifi Maram, Lily Marama, thank you. Joyfulness Study, Adene Patricia, Beams Couture. Thank you guys. So let us keep talking here. So you can see this diagram here. You can see the womb in red. You can see the ovaries on that side. That is this stuff in black. That's the ovary. And you can see the ovary on this other side as well. Ectopic pregnancies, any pregnancy outside the womb. If the pregnancy is not in the womb, it's ectopic pregnancy. That is just the definition of ectopic pregnancy. Thank you. Happy Sunday to you all. And thank you for joining today. Thank you, Asa Young. Happy Sunday. Any pregnancy that is outside the womb is ectopic pregnancy. We call it extrauterine pregnancy. Okay? Okay? So this is where pregnancy should be. A normal pregnancy. Okay, that is normal. If the pregnancy is not in the womb cavity like this one, then it is ectopic pregnancy. Now, listen attentively. Okay? Most ectopic pregnancies, okay, are in the tube. Okay? However, ectopic pregnancies could be anywhere. They could be on the cervix here. Okay? If you've had a previous C-section and you had a cut there, ectopic pregnancy can be implanted in the scar tissue. We call it cesarean scar ectopic. Ectopic pregnancy can be in the cono. Cono is the junction between your tube and your womb. Ectopic pregnancy can be in the cono. Ectopic pregnancy can be even on the ovary itself. Ectopic pregnancy can be in your tummy. Okay? Ectopic pregnancy obviously can be in the tube, like I've said here, can be anywhere, even in your tummy there. Okay? That is ectopic pregnancy for you. But most cases, 90% of ectopic pregnancies will be found in the tube, this way, this one. You can see that arrow there. Let's put the arrow in blue. So it's totally different and distinct, and you can spot that out. Most ectopic pregnancies will be in the tube, okay? But ectopic pregnancy can be anywhere, Any pregnancy that is not in the womb cavity is ectopic pregnancy. It can be on the cesarean section scar. We call it cesarean scar ectopic pregnancy. It can be on the cervix here. Call it cervical ectopic pregnancy. It can be on the ovary, ovarian ectopic. It can be in the tube, tubal ectopic. It can be in the conal ectopic. It's very difficult to diagnose ectopic pregnancy if it's not in the tube. It's very easy, difficult, but much easier to diagnose ectopic pregnancy that is in the tube. Okay, but if ectopic pregnancy is not in the tube, maybe it's in these other funny locations, the cervix, the cesarean scar, on your ovary, on the conal, which is very common as well, they're difficult to diagnose. Okay, but most importantly, ectopic pregnancy is pregnancy outside the womb. In ectopic pregnancies, okay, because ectopic pregnancies can bleed, okay, so also ectopic pregnancy can also be on the tube outside here, okay, just outside on the tube there. So first things first is that what causes ectopic pregnancy? That will be the first thing you want to ask me, and that's the first thing we want to talk about tonight. What causes ectopic pregnancy and why do they kill? Please follow me. We have Johan Emele joining in from Cameroon. We have Cynthia Vincent Okiere 6515. Inu's finest, and everybody coming up live. Thank you guys. God bless you. Thank you so much, Queen. So, what causes ectopic pregnancy? Anything that will cause disruption in the transportation of the egg being released from your ovary to move into the tube and find its way all through to get here. Anything that will cause traffic along the path of a released egg, okay? Anything that will cause traffic along the path of a released egg from the ovary into the tube and along its course in the tube to get into the womb. Any obstruction there will cause ectopic pregnancy. Now, what can cause those obstruction? What can cause any of that kind of obstruction? If you've had any previous operation on your tube, maybe previous ectopic pregnancy, okay? If you've had maybe a previous operation in your tummy that has caused an infection, it can cause damage to your tubes. Appendicectomy, fibroid removal. But if you need operation for your appendix or fibroid, don't say you're not going to go because it's a risk of ectopic pregnancy. As far as the operation is done properly with proper care and there's no infection setting in, and they take care that there's no infection that complicates your operation for appendix or for removal of fibroid, ectopic pregnancy from such cases is very rare. The other thing that can cause damage to the tube, apart from surgery on your tube, which could be previous ectopic pregnancy or previous operation in your tummy, is definitely infection in your tube. Infections like chlamydia, gonorrhea, those two infections, chlamydia, gonorrhea, they cause serious damage to your tubes and they can cause blockage in your tube so that the eggs cannot pass through. So chlamydia, gonorrhea, they have this attitude of causing blockage in your tube. And when there's blockage in your tube, the egg stops there, okay? But the sperm has a way of finding its way all the way through. So the sperm will swim down, and pass along this infection blockage and get to fertilize the egg. But because the eggs, they are very big. A released egg can be as big as this. A released egg from your body, from your ovary, can be as big as this. So once the egg is fertilized, but it can't find its way through the tube because the eggs are normally bigger than sperm. Sperm are microscopic, but egg, when you put a normal magnifying glass, you see egg. But because the fertilized egg cannot move on its way down because the tube has been blocked by infection, previous operation, the egg is stuck there. And once egg is stuck, it will start to implant in the tube and start to grow. Okay? But the funny thing is that A tube, fallopian tube, is designed as a conduit, like an expressway. The fallopian tube is designed to allow the car, the egg, to pass through. You drive on high speed on your expressway. Once you park on the expressway, you're going to cause obstruction or cause an accident. Imagine an expressway from Lagos to Ibadan. That is a normal expressway, no traffic. Suddenly a car stops in the middle of the expressway. That car is going to cause massive accident. That is the same thing to ectopic pregnancy causes. Suddenly the fertilized egg, cannot find its way through the tube because it's blocked, because the infection has caused blockage in the tube. The egg will start to implant and start to grow in the tube. But because the tube is not designed to expand and to contain a whole baby, you see, the tube will rupture and it will burst. And once it bursts, it starts to bleed and starts to leak. And I'll tell you where that bleeding can cause and where that bleeding will go. But normally, a fertilized egg that moves and finds its way into the womb cavity, like this one, will implant in the wall of the womb. It starts to grow and gets big as a baby, as big as my head. A normal uterus has ability to expand and to be as big, almost times 2 the capacity of my head. The womb is designed to be hypertrophic and hyperplastic. The womb gets bigger and bigger and stretches, but the cervix cannot stretch. Once the pregnancy starts to grow and it reaches about 6-7 weeks in the tube, it will rupture the tube. And once the tube ruptures, that tube starts to bleed, and the blood will collect inside the tummy. It will collect inside the tummy. And this tummy can contain over 4 to 5 liters of blood. That is your total blood volume. Your total blood volume is 5 liters of blood. Imagine your tummy is able to contain all the blood in your body system. So if a woman starts to bleed from ectopic pregnancy, it's like when you lock a tap and you open it small and it's leaking, tum, 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 tum. That's the way ectopic pregnancy can bleed into your tummy. Or it can even bleed as a gush, like a tap. And within hours, it can make a woman exsanguinated. The woman is pale and white. She's pregnant. Ectopic pregnancy is the first diagnosis. If you see a woman coming into the hospital, she's pale. You check her eye like this, she's pale. You check her test of pregnancy, she's pregnant, and she has serious pain in her tummy, usually on one side, left or right. The first diagnosis that comes to your mind as a doctor is ectopic pregnancy, because if you miss it, the woman can die right in your front. Ectopic pregnancy has ability to bleed, and you can lose a whole woman within 24 hours. The blood of a woman, of an adult woman, can bleed and can be stored in the tummy, and the woman can die because the blood will be collected in the tummy and the blood cannot go back into the general circulation, and the woman can die. So what kills a woman from ectopic pregnancy is that pregnancy is stuck in the tube. That pregnancy is fertilized in the tube because the sperm is microscopic. The sperm is small enough and it can find its way. It can meander around the womb, around the blockage in the tube, and it can go and fertilize that egg. But once the egg is fertilized, the egg cannot move. The egg cannot transport itself through the blocked tube, and it's stuck there. It grows there and it implants. Once it implants, after a while, it grows up to 6 to 7 weeks. It will rupture the tube, and once the tube is ruptured, the woman starts to bleed and she can die. Now, you ask me, why can't the egg pass through the other tube? Any part of the ovary, any ovary can ovulate, and you can ovulate from this ovary, and the egg can be picked up by that tube. You can ovulate from that ovary, and the egg can be picked up from that tube, or the egg can be picked up from its own tube and goes into the womb. Usually, if you have an infection like chlamydia, like gonorrhea, they must be treated on time. If you don't treat your infection on time, chlamydia or gonorrhea, they cause damage to the tube. And the more you have recurrent infection, the more you expose yourself to infection like chlamydia, like gonorrhea, they cause cumulative damage to your tube. By the time you have chlamydia almost 4 times in a row, you've already caused blockage to the tube. Chlamydia, gonorrhea, they have ability, they have affinity, they have propensity, and they have that love and that affinity to lodge in your tubes, and they cause scar tissue. What chlamydia and gonorrhea will do to your tube is this: if you enlarge and you blow and you look at your tube under microscope. If you look at a fallopian tube under a microscope, a fallopian tube that has been infected, that has been damaged by chlamydia, this is what you see in the tube. Okay, now when you open a tube, you see this tiny air-like structure in the tube. These things are designed, okay, and this is the womb. These things are designed to move a fertilized egg all the way into the womb. Okay, what chlamydia does is that it will cause scar tissue. This scar tissue will be like cobwebs, like nets, like this, all over in the womb. Okay, and all over in the tube. So therefore, the sperm, they are tiny. They can find their way through all these webs, and they get to fertilize the egg. But the fertilized egg cannot move. It cannot move because there's blockage, and it will implant. So this is the end of the tube. So this thing here is what you see. Okay. So this is the end of the tube. So that egg fertilized cannot move. So it will implant there, and after a while it will rupture, and the woman starts to bleed blood. Boom, boom, boom. And it's so easy for a woman to lose all her blood within minutes. So this is what happens. Chlamydia gonorrhea will cause blockage in the tube. What else can cause blockage in the tube apart from previous ectopic pregnancy, infection, recurrent infection? Now, by the way, candida, thrush, yeast infection does not cause damaged tubes. Okay, it's chlamydia and gonorrhea most especially. Okay, and if you have any infection, it's always important that you get them treated. If you don't get treated as soon as possible by doing vaginal swab as soon as possible, you risk damaging your tube. The more infection you have over and over again, the more you engage in risky sexual behaviors, not using condom when having sex, you cause increased risk of damage, and damage actually to your tubes. You taking contraception does not prevent infection. Contraception pills and stuff like that, they only prevent pregnancy. But to prevent infection, STI, STD, chlamydia, gonorrhea, TB, bacterial vaginosis, is for you to use condom. Condom itself is a barrier contraception. It prevents actually contracting STD, sexually transmitted diseases. To prevent that, you need to use condoms. If you're not sure of your partner, you're not sure of your sexual behavior or our behavior, you should use condom. You should use condom to prevent STD, because if you risk exposing yourself to infection, you cause damage to your tubes, you're going to risk having a ectopic pregnancy. Now, what are the things you can know, or how can you know that you have damaged tubes before getting married? You want to say, okay, fine, doctor, I've done some silly things when I was younger. I've done silly things in NYSC. I've done silly things in high school. I've done silly things in university. How can I know that I do have damaged tubes before I get married? The best way to do investigation to know whether you have damaged tubes is to do HSG. HSG test is one of the best ways and one of the most reliable ways to know if you have damaged tubes before you get into any relationship that is going to lead to marriage if you want to. Okay, because you don't want to get married, then you start going through all the challenges of getting pregnant because you have a suspected blocked tubes. Now, some infections you're going to have, there's no way you can predict whether they will cause damage. The best thing is to always treat any infection you have as soon as possible without delay. So when you go to a doctor, you say you have a sign of infection, noticing offensive discharge, the best things first is to do swab tests to know what infection you have, if you have any infection, and then treat and prescribe the best antibiotic to treat such an infection. Now, remember I said that ectopic pregnancy can kill. And how it can kill is by it causing rapid bleeding from your tubes. Ectopic pregnancy, once it grows about 6 weeks in the tube, it will totally disrupt the tube, because the tube is designed not to hold pregnancy. The tube is designed to transport fertilized egg or transport egg from the ovary to the womb. If there's any blockage in the tube, the eggs cannot move. And once the egg is static and is stuck in the tube because there's traffic, it gets fertilized. Once the egg is fertilized, it will implant. Once it implants, the egg will outgrow the capacity of the tube to contain it. And after a while, the tube will rupture. Once the tube ruptures, breaks into two, the person starts to bleed, and they can bleed into your tummy. And the part of the body that the person bleeds to is called the pouch of Douglas. The pouch of Douglas is the space behind your womb and your bowels. That area can contain amount of blood up to 4-5 liters of blood. And remember, I said that your whole body contains about 5 liters of blood. So if you bleed like that into your tummy, you can easily cause death. And if someone has a ectopic pregnancy and that person is pregnant, you know she's pregnant, or you don't know she's pregnant, but sometimes she's having some bleeding in her vagina, she's feeling dizzy, in fact she's collapsed, the first thing you should do to take her, don't even waste time and start calling a doctor. Just take her to the emergency. Just take her to the emergency. Take her to a competent doctor as soon as possible and let them know that she's possibly pregnant. The first thing we're going to do is to do a test of pregnancy, whether by urine test or blood test. And if we know that this person is pregnant, she's clammy, she's cold, she's fainting, the best thing is to open her up in surgery and then take out the tube. Okay, once a woman has ectopic pregnancy in her tube, that tube is damaged. That tube has to go. It's difficult to repair a damaged tube from ectopic pregnancy. But if the person has one already damaged tube from a previous ectopic pregnancy, we try to conserve that damaged tube. But if the damaged tube is totally damaged, what we need to do is to totally take out the tube, to take out the damaged tube on this second occasion, and the person will need to use IVF to get pregnant in future. Now, the best way to treat ectopic pregnancy, if someone is obviously fainting, about to die, is to open that person up with a open incision in her lower tummy. If the person is stable and there's skill available for keyhole surgery and there's equipment available, the best thing will be to do keyhole surgery, what we call laparoscopic sapengectomy, to remove the ectopic pregnancy. But if the person is dying, there's no available skills, and the chances of opening the person quickly to save the person is very limited, the best will be to open the person up quickly, remove the damaged tube. Once that person has ectopic pregnancy, once anybody has ectopic pregnancy, the treatment is to remove the tube. There's no other way. If we think that one tube is already damaged, that is to say, if the person has had a previous ectopic pregnancy and one tube is already gone, and this new leftover tube is also damaged again with this current ectopic pregnancy, sometimes we will try to salvage that remaining tube. But have in mind that there's a chance that you might lose even that this newly damaged tube, and the person will need IVF to get pregnant again. I've seen cases where we try to reconstruct the tubes together, but the thing is, that to be honest with you, once a tube is damaged already from infection, from a previous ectopic pregnancy, then that person has got a damaged tube. Now, another cause of ectopic pregnancy is if someone has had sterilization before. If you've had sterilization before, that means that we've clipped your tubes before to prevent you from getting pregnant again. Then, that if you get pregnant from that after such a case, you're likely going to have ectopic pregnancy. What I'm trying to say is that if you've been sterilized, we've clipped your tubes for a permanent contraception, and suddenly you get pregnant, you miss your period, you do test for pregnancy, is positive, the chances are that the pregnancy is stuck in the tube. So if someone has had a previous sterilization of our tubes, okay, to what we call tubal ligation, bilateral tubal ligation, we've tied your tube on two sides, and suddenly you get pregnant, then there's a chance that you have ectopic pregnancy. In such a case, we have to open you up or do keyhole surgery to save that person's life. Now, I'm going to open the floor for general questions for about 10 minutes to answer questions for you all, then we close down this discussion today. So let us open the floor. Now, by the way, if you're trying to get pregnant and you want one-to-one consultation, we are available, and I'm available for you. And we're always running our premium services packages. We have the weekly package, 1 month consult package. We also have the gold, diamond, platinum package, which is for a year, and they come with different access to the ATG group. If you're pregnant as well, there's no reason why you should not be registered for the ATG Antenatal Forum. ATG Antenatal Telegram Forum is for every pregnant woman, and if you're yet to get pregnant but you can't afford the packages for the premium services, why not join the DTC package on the Telegram group as well? All right, it's going to do you a huge favor. A lady recently has been in an antenatal group, and she said she does not regret ever being in the Telegram group ATG Telegram Group Antenatal or GTC. Try and join them. They are expedient and very, very good, valuable resource to speak with the Dr. Esther and other pregnant women as well. So obviously to enrich and ensure that you have a safe pregnancy and a safe delivery. So the floor is open now for questions. And if no questions, then we close down this discussion today. And we also have a seminar running next 2 weeks, the ATG Fertility, Infant Fertility Bootcamp. If you've not registered for the Fertility Bootcamp, now is the time to register. There's a question here from Asa Young. Doctor, what are the causes of low-lying placenta? How can it be corrected after 35 weeks? So let us explain low-lying placenta and how it can be corrected as well. Okay, now let us talk. I'm trying to rub off these explanations here so I can use this board clean to explain low placenta. Good. Good. Right, so now this is the womb. That's the tube. That's the tube on that side. That's the opening of the tube there. Okay, and that's your cervix. Okay, that's the hole which maybe comes on form. That's your tube here, and that's your ovary on both sides. Okay, so first of all, when we say low-lying placenta, what it means is that the person is already pregnant, so that is the baby. Okay, that's the baby's head, that's the baby's legs. Okay, and that's the baby's hands. Okay, good. Can everybody see? So we're trying to talk about low-lying placenta. Now, I'm going to put your placenta as black color. Placenta as black color. There's a question here. Doctor, my tubes are blocked from endometriosis. You want to know what's the way out. If your tubes are blocked from endometriosis. Yeah, I forgot to mention, endometriosis also can cause tubal blockage. If your tubes are blocked from endometriosis, to be honest with you, the way out, Dorcas, is through IVF. Edith Idioma, can HSG block tubes? No. Can HSG clean blocked tubes? No. HSG is not designed to unblock blocked tubes. Okay, right. So if you're pregnant and your placenta is in this part, so this placenta, okay, that's cord to baby. That's placenta, and it's almost touching here. Okay, we call that low-lying placenta. Okay, low-lying placenta can be found in pregnancy at any time, maybe from about 20 weeks onwards. Okay, but in most cases, as the womb gets bigger, the placenta will move up. So as the womb gets bigger, okay, now this womb will now become this. Okay, the placenta will move from here to somewhere here. Okay, somewhere here. As the womb gets bigger, low placenta moves up. Okay, so in most cases, almost 70 to 80% of placentas that are low, almost 70 to 80% of low placentas will move up as the pregnancy progresses. About 5 to 20% of them will not move. Why they don't move, we don't know. But there are risk factors for why they don't move. If you've had a previous C-section in your lower womb, obviously, or you have a previous C-section on the upper part of the womb, there's a chance that the placenta can be low-lying and is stuck to the previous cesarean section scar. If you've had a previous operation, myomectomy, with a cut on your lower part of the womb, it can increase the risk of low-lying placenta. Okay, so those are the very, very commonest reasons why people have low placenta, but in most cases we don't know. But few things like previous operation, myomectomy, fibroid removal, previous low-lying placenta, previous C-section can cause low-lying placenta. There's a question here on Instagram. Doctor, does PID block tube? Yes, PID can be caused by chlamydia, gonorrhea, and they cause damage to your tubes, and they increase the risk factor of having ectopic pregnancy. That's on Instagram. So low-lying placenta, those are the causes. So during pregnancy, if you've had a low-lying placenta before, okay, we scan you frequently to check your cervix, to check your cervix, to check the placenta if it's still low. We can scan your tummy to see placenta if it's moving away from your womb, up. Now, if after 35 weeks, placenta is still low, no big deal. Placenta can be low, okay? But if it's about 2.5 centimeter away from the opening of your cervix here. So if placenta is here, it's too low. If it's about 2.5 centimeter, so placenta stops here, about 2.5 centimeter distance, okay, from the opening of cervix is okay. But if it's less than 2.5 centimeter to your cervical opening, then we have to do a C-section. Okay, there's no way in the world any doctor can physically move placenta up. If it's going to move, in most cases, it will move up itself as the womb gets bigger. As the womb gets bigger, it pulls the placenta up. Okay? All right, very good. So that's that for James. Somebody that asked that question. Can a woman trying to get pregnant taking Dostinex continue? Yes. If you're trying to get pregnant and you have hyprolactin, you've been given treatment to treat the hyprolactin with Dostinex, and you get pregnant, then you stop the Dostinex. But if it's not coming down, that is to say, if the prolactin is not coming down with the Dostinex, see your doctor again. They might need to change the medication or increase the dose. But once you get pregnant and you're on Dostinex, even before you got pregnant, you stop the Dostinex. You don't continue anymore. If you've forgotten to stop it today. Okay? Can hernia prevent pregnancy? No. Hernia in your tummy does not stop you from getting pregnant. Hernia in your tummy does not stop pregnancy. What happens to unfertilized egg with blood fallopian tube? So if your eggs, okay, is stuck in the tube from blocked tubes and it's not fertilized, it will degenerate after a while and it will die off and the body absorbs it. Case closed. So remember, some people do release egg and it gets to their womb and there's no sex. They don't get pregnant. The body has a way of causing the egg to degenerate and to be absorbed by the body. So if your tubes are blocked, the egg is not fertilized, it will degenerate and the body will absorb it back and nature starts again. Thank you guys for joining me today. I really appreciate you. I hope to see you soon, later today or tomorrow, all things being equal. Once again, I want to say happy Sunday and I want to wish you the best of the week ahead. God bless you and see you soon. So, question here: what is the way out for a young woman trying to conceive with multiple fibroid? If you have multiple fibroid and they are more than 4 or 5 centimeters each a piece, the best will be to remove the fibroid as soon as possible before you try to get pregnant. Because multiple fibroid has a way of increasing the risk of you not being able to get pregnant and also increasing complications as well associated with pregnancy. But I've seen people with a lot of fibroids, they get pregnant and they're fine. But if you've been trying to get pregnant, like you said, Mrs. Kemi, if you've been trying to get pregnant for more than 2 years and you're known to have multiple fibroids, the best will be to get an MRI scan and to consider taking out those fibroids and starting all over again. Doctor, does consuming herbal bitters like Rizu precisely prevent pregnancy? Honestly, I don't know about herbal medications. I don't know what it contains. I don't know what concentration of whatever it contains is contained therein. So there's no way on earth that I'll be able to advise about herbal medications. I'm a doctor. I'm not an herbalist yet. I've not been to the University of Herbal Concoction, so I have no idea. And honestly, I have no idea of what is in Wuzu, of what it contains, or the concentration of what it contains is contained. I have no idea. So my advice is for you to stop the Rizu. But if you want to take it, that's fine with you. It's up to you. But I got no idea in this world anyhow about any herbal thing. Can ulcer prevent pregnancy? No. Can a narrow cervix be dilated? Yes. If your cervix is narrowed from maybe previous D&C, previous infection, and we know it's narrowed, okay, we can dilate it through what we call cervical dilatation. That is true. All right. Thank you, Kim, for that question. Okay, guys. Hope to see you all soon. Have a wonderful week ahead. Love you all. Most importantly, I love myself too. And have a wonderful day.